can sustainable healthcare actually lead to global peace? I mean, it sounds a little far-fetched, right?
Yeah.
But that's exactly what we're going to be looking at today with this concept note from Dr. AKM Hai.
Hmm.
He's arguing that sustainable health is more than just hospitals being eco-friendly.
Hmm.
It's got these huge implications for peace and prosperity around the world.
You're absolutely right. And Dr. Hai really pushes us to think outside the box of traditional healthcare.
Okay.
He says that it's all intertwined: health, the environment, economics, social justice, even peace.
Okay. I'm intrigued, but I'm also a bit skeptical. I can see how health impacts the economy, like when people are sick, they can't work, or healthcare costs can be just crippling.
Right.
But how does that tie into something as complex as world peace?
Well, let's look at an example from Dr. Hai's notes.
Okay.
He talks about deforestation in certain regions leading to new diseases popping up
Okay.
as people are coming into closer contact with animals.
Right?
These outbreaks then overwhelm healthcare systems that are already struggling. And this leads to instability and conflict as resources become more scarce and people start losing faith in their governments.
Wow. Okay, I see the connection. It's like a domino effect.
Right.
But this example kind of highlights something else that Dr. Hai emphasizes,
Mm-hmm.
which is the whole concept of sustainable health itself.
Right.
It's more than just making sure hospitals are energy efficient.
Absolutely. Dr. Hai defines sustainable health as making sure that healthcare systems are meeting current needs, but can also thrive long-term without harming the environment or forgetting about social needs.
Okay.
And he breaks this down into 4 key pillars: access and equity,
Okay.
quality of care, environmental stewardship, and economic viability.
Okay, 4 pillars sounds pretty straightforward so far.
Yeah.
But let me play devil's advocate for a second.
Okay.
Aren't some of these pillars kind of in tension with each other?
Hmm.
Like, how do you balance environmental stewardship with economic viability when eco-friendly solutions are often more expensive?
That's a really great question, and Dr. Hai acknowledges this tension. He says we need to move away from this idea of either or
Okay.
and embrace a more integrated approach.
Hmm.
So, for instance, investing in renewable energy for hospitals might seem expensive up front, but it can lead to savings down the road and reduce reliance on fossil fuels, which is good for the environment and the economy.
So it's about taking that longer-term view
Right.
and recognizing those connections.
Yeah.
But what about the quality of care itself?
Mm.
How does that fit into the sustainability equation?
Dr. Hai is very clear that access to healthcare doesn't mean anything if the quality isn't there.
Right.
He argues that sustainable health systems need to invest in training skilled healthcare workers, adopting practices that are backed by evidence,
Okay.
and really focusing on implementing strong quality control measures.
Yeah.
If people don't trust the healthcare system or they don't believe it's effective, they're not going to use it, even if it's available to them.
Right. That makes sense. It's about building trust
Mm-hmm.
and making sure that the care is actually beneficial. But this whole discussion makes me wonder, how do you actually put these big ideals of sustainable health into practice in the real world?
Yeah.
It seems like a massive undertaking.
It is a really complex challenge.
Yeah.
But Dr. Hai doesn't just point out the problems, he actually offers some solutions.
Okay.
And that's what we're going to look at next.
Yeah.
We're going to look at the global landscape of sustainable health and explore the specific strategies that he suggests going forward.
That sounds good.
Yeah. So we've talked about how sustainable health is this really intricate web connecting everything from the environment to economic stability.
Yeah.
But where do we even start to tackle something so complex on a global scale?
That's the million-dollar question. And at the end of part 1, you mentioned that Dr. Hai actually offers up some solutions.
Right.
What are some of his key strategies?
Well, one major initiative he highlights is this push for universal health coverage,
Mm-hmm.
or UHC.
Okay.
But I think instead of just explaining what that is, which a lot of you probably already know,
Yeah. I think our listeners are pretty savvy. They know the basics.
let's look at the real world.
Yeah, let's get into the details.
The challenges and successes that Dr. Hai points out in his note.
What are some hurdles that countries face when they're trying to actually implement UHC? And what are some examples of where it's actually working well?
Well, one major challenge, especially for countries with limited resources, is figuring out how to fund UHC without breaking the bank.
Right.
He uses the example of Rwanda, which has made amazing progress towards UHC
Okay.
by implementing a community-based health insurance scheme.
Okay.
That's really clever.
Hmm.
They basically leverage the existing social structures in the villages to collect premiums
Oh, wow.
and make sure that people are contributing.
So it's about finding creative solutions that are tailored to the specific needs of that country.
Exactly.
That makes a lot of sense.
Yeah.
But even with funding figured out, UHC can be undermined by other global challenges.
Hmm.
Like we talked about before, climate change, emerging diseases.
Exactly. And while UHC is all about providing equitable access to care, climate change kind of throws a wrench in things.
Mhm.
Dr. Hai gives this really stark warning about the possibility of climate-related disasters, completely overwhelming healthcare systems,
Yeah.
especially in areas that are already struggling.
It's like you're trying to build a solid foundation for healthcare, but the ground just keeps shifting beneath you.
Right.
Honestly, it's overwhelming. Is there anything to feel optimistic about in this scenario?
There is, and this is where I think Dr. Hai's work gets really interesting.
Okay.
He really believes in the power of technology to completely transform healthcare
Okay.
and make it more sustainable.
Okay. I'm all ears. Tell me about the tech solutions that have you feeling hopeful.
Well, one area he's really enthusiastic about is telemedicine.
Okay.
He thinks it can revolutionize the way we deliver care, especially in remote areas where access to specialists is really limited.
Okay.
Imagine being able to consult with a cardiologist from your village using just a smartphone.
Yeah, that's incredible. That could really change things for rural communities.
Right.
But I can already hear some people saying, but what about the digital divide? Won't telemedicine just make those inequalities worse if some people don't have internet or devices?
That is a valid concern, and it's something that Dr. Hai addresses directly in his notes.
Okay.
He argues that we need to be really intentional about how we implement these technologies and ensure equitable access.
Right.
Think about things like digital literacy programs.
Okay.
It's not just about the technology, it's about creating an entire ecosystem that works for everybody.
So it's back to that interconnectedness. The idea that technology alone isn't enough,
Right.
but it can be a powerful tool when it's used thoughtfully.
Right.
What are some other tech innovations that Dr. Hai is excited about?
Another area he's really into is artificial intelligence, or AI, in healthcare. AI can analyze tons of data to find disease patterns, predict outbreaks,
Wow.
and even personalize treatment plans.
AI predicting outbreaks, that sounds like something out of a sci-fi movie.
Yeah.
But wouldn't that require like massive data sharing across countries and health systems? Is that even